Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. This is the Purr Podcast, and I'm Dr. Susan Little, and with Dr. Kelly St. Denis, because Jolle is off on the other side of the world, and we've been let loose. Mm-hmm. We've been let loose, yeah. So now we've got our own podcast, Kelly.
Yes. Yeah. And today's the ABVP Feline Podcast.
It is. We have 3 ABVP feline specialists in the house, and I think that's a first for us. So, yes. And so we have Dr. Lisa Restine with us again. So just remind people, Lisa, about like who you are and what you do.
Well, I am a feline practitioner. I spent about 9 years in a feline-only practice, did some ER, and now I work for Hill's Pet Nutrition as a feline content expert.
So we left off the last episode just kind of starting to get into what tools are available for vets and their team members, right?
Yes.
To help get nutrition information out, because the length of time that vets have to see patients isn't getting any longer. Like each appointment doesn't get longer, right? It seems to get shorter, right? And so how can we deliver that information, right? So what's your take on some of the tools? And we'll talk about World Small Animal Vet Association, WSAVA, who have a great global nutrition committee. So what's your take on some of the tools that they offer, and can we use them in practice?
I think they're extremely useful. They have already pre-made forms where they go through the nutritional assessment questions, and so you don't even have to make up your own, or you can just use their ideas and create one that's branded for your clinic. They have client-facing handouts that answer some of those questions we get on a regular basis. Why shouldn't I feed a raw diet? They have a handout for that. So, again, you don't have to put in the time and effort. Someone else already did, and it's great.
Mm-hmm. Yep. So I'm interested, Kelly, because you did only feline for a very long time, right? And now you're sort of in what I call mixed practice.
Yes.
Again.
Although I don't.
Oh, that's true. You don't see the lesser species, right? Yeah.
I kind of give them a wide berth now because I don't know how to interpret their emotional language anymore. So.
It's hard, isn't it? Yeah. They're different.
I don't know what they're feeling, so I just stay away from them. And someone said, "Are you scared of dogs?" And I said, "No, I just don't know how the dog's feeling, and I'm not going to get in his face to find out."
I can't speak.
Oh, I said the word.
I can't speak their language.
Yes, exactly.
It's very true. Yeah. So you get to see just the cats, right?
Yeah.
So I'm interested in your take too. Like, people are all different, and some people are really happy to have something to read, right? And some people they won't read it, right? They want to look at something online, or right. So how do you tackle that?
I try to have all the options available. So I have a whole panel of brochures from the American Association of Feline Practitioners that I think are the most applicable brochures. And if someone wants to take one, they can. But most of the time I'm emailing with caregivers and emailing them the link to the brochure or a link to something like the World Small Animal Vet Association where I think they should be having a look.
Yeah.
And a lot of people obviously do their own Google searches ahead of time. And so I just try to direct them in the right way to what I think they need to read.
And AAFP makes a lot of their material available for free.
Yes.
Including these brochures, right? So it's catvets.com. You can always go there and have a look. So, but but that's a step too, right? So you have to write the email and then send the link,
that's
right? So I'm thinking that the care team around us can take over some of that.
Yes.
Right?
Yeah.
What are your thoughts on that?
I think if you spend the time to train your staff and to be, your advocate and the advocate for your patients, it's going to make everyone happier. They can provide a lot of that educational content. I don't think we appreciate or utilize our technicians enough.
Mm-hmm. Yeah, and it's a funny thing that sometimes you're your team members have more influence on what owners do than you do.
Absolutely.
Yeah.
So Kelly and I used to work together years ago, and if you remember the exam room, Kelly's got that sliding door, right?
Yeah.
And so the client would leave, and the reception desk is just on the other side of the sliding door, and I'd be in the room just like finishing my notes, and I'd hear, right? And I'd hear clients go out and talk to one of our staff and say, so Dr. Little says, we need to go to this type of food because of this, and what do you think?
Yes.
That happens all the time.
And then the team always have an opinion too. Hopefully it reflects yours.
Well, that's just it, though,
Yeah,
right? If they're not on
nice.
your side,
Yes.
right? Yeah.
And now I know there's actually a new certification for technicians in the feline specialty. So if you know that you have that really dedicated technician, that's available now, which is really exciting.
And I think other team members too. There's resources for other team members to up their game, isn't it?
Yeah.
Yeah.
Well, one of the things that I'm plugging AFP is the feline certificate program
Yeah.
Right.
that we have for vets, the technicians, and then also all of our
All the
associates
support
in the,
staff,
in
yes.
the practice, because there is stuff like nutrition and other types of information in those that can really help kind of bring everybody to the same playing level.
Yes.
And you were talking about some projects that you're working on where you're going to be trying to help with feline content. Or what are your thoughts in terms of working with the technicians, because we do need them to help us with our nutritional consults and follow-ups, because we don't have all the time to do it.
I think that's key. I really feel like they're such an untapped resource, and I know how much I relied on my technicians in practice and how valuable a good technician is, and how I'm still close friends with so many of the the technicians I've worked with, because they're really dedicated people, and if you actually tap into that and give them a chance to thrive, they will, and we just have to provide
They're
it.
kind of unsung heroes. They remind me of like nurses in medicine, right? Like they're kind of unsung heroes.
So much.
Yeah, and I have two technicians that work with me. Kelly knows them too, Nancy and Chantal.
That's how long they've been there. 'Cause it's been a long time
Yeah.
since I worked at your practice.
Yeah, they've been with us for decades, and we could not practice without them. So I'm really happy to give a shout out. And I think Kelly will back me up on this, that they know so much, don't
Yes, they do. Yeah.
they're really cat oriented, and they've learned skills, and I find myself going to them and asking.
Yes.
They build up that intuition over the years too. They
do.
know often before we do it.
And they often know the cat better than we do.
Yes, and they're a great safety net. Are you sure you want to that's a really nice thing to have.
That's a great idea.
That backup, and you as a doctor need to listen to them when they're making sure they're not trying to question your authority. They're just trying to help the patient.
Yeah.
And I think that's hard.
It is, but I think when vets start to let go of some of this stuff.
Good luck.
Yeah,
Yes.
yeah, that they actually don't even have time for, but it's still hard to let it go, right? I think when they can get to that point, right, if they do it right,
Yes.
right people, the benefits are huge,
Yes.
right? I think that's a really important way to try to get that nutrition recommendation that we want to give and get it out to clients. Yeah. Let me ask you, do you think cat owners need to hear or let's say receive nutrition information any differently from dog owners? Is there a cat versus dog owner?
To be honest, I haven't really worked with the canine.
D-word? Oh, I said dog.
Twice.
Yeah.
Yeah, you do.
Oh, we need a little counter, right? I've said it
It's
twice.
too early in the day to have a drinking game, Susan.
Aw,
It's 12 o'clock somewhere.
okay.
That's what I would like.
Yeah, we'll just go to another time zone.
Penny in the jar every time we use the D word, because I
Okay.
do too.
Okay. Yeah.
Most of my D-word owners were from the ER level,
Okay.
where the nutrition recommendation really was either a temporary
okay.
thing.
That's true, that's true.
A lot of like GI
Gotcha.
diets kind of things.
Gotcha.
So
Yeah.
I don't really know how to talk to them very well.
Do you know what? So there's a little bit of research done on the difference between cat and the lesser species owners. That's really, a lot of it's kind of soft data, but even so, different ways of researching it often come up with the same answer, which gives me a little bit of confidence. So I've just wondered if companies like Hills look at that and say, oh, because there actually is differences, right? There's differences. Yes. So cat owners are more likely to go to social media for their, right?
Yes, and I know that Hills definitely has looked at a lot of those, studies or done some of their own internal things with some of the cat parents, and that's part of my job is to explain how to communicate to cat people, because I practice medicine, but I'm also a cat person, and I'm in that is my world online too. So I understand how we communicate with each other. Yeah. And it's just very different.
It is, I think
from what they want me to do.
You're getting to define your position. It sounds a little bit fun in some ways.
It is very fun in that way, where it's a lot of freedom, but there's also a lot of self-pressure to make sure that I'm doing everything I can. Because I really want to fight for the cats.
Be kind to yourself, Phil. Yeah. Be kind to yourself.
It is, I will say one thing, it is a wonderful environment, and the team members are just absolutely fantastic. Going from practice to industry, I wasn't sure what to expect.
Sure.
And you kind of think, you see all the office things and what's going to happen. It is a wonderful environment. So it's a very, very nice place to be.
That's great. And when it's a newly created position, right, you do, as Kelly said, have a bit of an opportunity to shape it for yourself, right?
Just don't go completely off the rails.
I'll try not to.
So let me ask you: Did you have any sort of specific interest in nutrition before you came to Hills? I always like to ask specialists or people who are working in a certain field, before you got that job, right? Was that on your radar?
Probably not that much.
Yeah.
It was the same, similar to probably most of us. It was always we should feed this diet, and you kind of just go by what you get from your reps, and not really understanding all of the details behind a lot of it, So I love it now, but I didn't really have the time to seek out a lot of extra knowledge.
Yeah. I think that's one of the key things, right? Is building the time for it. Yeah. So you're in a bit of a mentoring and teaching role, I'm thinking.
Yes, I don't have anyone that I'm like, this is how you cat, but I definitely teach a lot. I do a lot of webinars, and I'll speak at conferences, and I do things internally just on meetings, and just try to walk through things with people, just to kind of help them get into the brain of the cat and the cat owner, because it's different.
It's very different. Yeah.
So I know you gave, I think Kelly and I both saw a lecture that you gave yesterday. So we're at the AAFP meeting in Minneapolis. And so, you're up on a big stage, and it's a big room, right? So
the big echo.
How does that feel?
So I have lectured in similar size, but this was the most intimidating lecture I've ever given. I mean, to have these two plus more people that probably know way more than I will ever know sitting there listening to me talk was a very humbling experience, and I was very nervous. So just about being up in front and in that position, but it was awesome, and I think it was an amazing experience.
Yeah, it is. It is intimidating to be talking to a room full of people, right? Who a good percentage of them are specialists.
Yes.
Isn't it?
And the rest of them are all just cat crazy.
Yeah. So, I'm like, I don't know any more than you do. Why are you listening to me? I should be listening to you.
Oh, you should be so humble about it, though. I mean, it's a big deal to be here and lecturing at the AFP. So from the opposite view of it, you should be patting yourself on the back.
Yeah, you
Look
should.
at me. I'm up on the stage at AFP.
Yes.
Right?
Yeah. I'm working on that part.
Yeah.
Here I am.
You have a good presence and a good voice, and that makes a big difference, actually, right? Because you need to be able to deliver your information in a way that people will actually listen to you. So. Yes. So don't from two people who have been lecturing for a long time, don't undervalue yourself. So I used to do a lot of lectures on feline reproduction. Partly because I was probably the only person anybody could find who could do lectures on feline reproduction. And so I remember doing a lecture at some conference, I don't remember which one it was, and within the first 5 minutes, my eye caught a fellow sitting at the back of the room who is a reproduction theriogenologist.
Oh, yes.
There's a theriogenologist in the room, right? And I'm actually talking about some of his research, and it threw me off for the entire lecture.
I felt very similar yesterday when some of what I mentioned was from a lecture, and I saw the lecturer there in the audience, and I said, oh no. I hope I don't mess it up.
That happened to me once too. I was lecturing at Western, and I was lecturing on gastrointestinal disease. I think I might have been citing Gary's paper. And Dr. Susan Little walked into the room and sat at the back of the room.
Did I?
And I was like, oh, Susan's in the room.
Aww.
So she was just there to see what I was doing and support me.
Yeah, absolutely.
And
Absolutely.
I was like, oh, crap.
Yeah, I bet you that happens at least once to a lot of different lecturers, though,
Yeah.
right?
Yeah.
Your eye spots somebody there, and you go, oh, and it's, at least for me, it's hard to. I lose my stride,
Yeah.
and it's hard for me to. That's why I go to the back of the room.
Yeah.
Yeah, unless it's Jolle, and then I sit right in front of them, right? Yep. But I bet you that's a common experience. Yeah.
One of the things I try to do when I'm feeling that way at the beginning is always think about the fact that I have some things to share with people, and it might not be for everyone, and they may know some of what I'm telling already, but I'm sharing things with them that may be of value. So I just always try to remind myself.
I really like that. Yeah.
There's people in this audience that are going to benefit from what I have to say.
Yeah.
And you get up there, yeah.
Even if it's just one thing, it's still one thing that they didn't know before.
That's a great way to look at it, because even if you, let's say you're the top specialist in whatever it is in the world, right? There's still going to be people in the audience who can't learn from you and people who can. I just think it's probably always going to be like that, right?
Yeah.
Right. And I think for the three of us, like when we lecture, we're lecturing from a practice background.
Yes.
Right? We're not lecturing from a corporate background, or we're not lecturing from an academic background. And so I do think we say different things, and we say things in a different way.
Yes, I definitely noticed
Bring
how
something different.
You talked yesterday just about, you understand being in the field. It's so different coming from, someone in industry.
It is, and I think that's a great thing that those of us coming from private practice are able to do, right?
Yeah.
There's a nice balance there.
There's a balance.
Academia, industry.
Right.
And the trenches, as I call it.
Yeah, we can talk about the real world.
Yeah.
Right? Yeah. So do you expect you'll be doing some traveling and some lecturing? Do you get out of Kansas or?
Yeah, they've sent me everywhere
Oh,
so
wow.
far. I've been, I went to Europe for a big meeting, like my first month at Hills, so that was my first time in Europe. And then this year I got to lecture at FISAVA, and I did a little Asia tour for some of the vet places there too. So I was in Taiwan and Malaysia and Singapore. It was really fun.
Oh, good for you.
World traveler too.
Yeah.
Yeah.
I would catch Jolle, but
Yeah.
I'm okay with that.
Yeah. I enjoy going to those countries too, right?
Yes.
It's a lot of fun.
I love seeing how things are so different, but yet so much the same. And, everything could be completely different, but everyone still has the same issues and the same things that they want seen and heard, and it's just really...
Yeah.
It brings us all kind of together, especially in the feline world.
And I learn things when I go to different countries too, right?
So much.
Yeah, you learn things that you can bring back and use, right?
Yes.
So that's great that you're getting out and about and spreading some more cat positivity, I guess, around the world.
Yes.
Yeah. So where do you see yourself, let's say, in 5 years' time?
I have no idea. I think I'll still probably be involved with Hills. Just at this point, I'm really happy and enjoying my role.
Yeah.
But I do think I'll probably have some practice somewhere, whether it's just 1 or 2 days a month or, but I can't stay out of the clinics for too long.
Yeah.
So I luckily have the freedom to do some relief at least.
Right.
Well, that's good.
Yeah. I think that's true of a lot of vets, right? It's really hard to never be in a practice again.
Yes, so many of the veterinarians that Hills employs do some sort of clinic work, because
there you go.
that's where our heart is. You know,
Right.
very few people go to vet school with the motive to not practice on animals.
Yeah, that's true. That's
Yeah.
true. Yeah.
That's true.
And I think it also keeps you in touch, right?
Yeah.
With what's going on in practice.
Yeah. And, you know, there's so many new feline things that have come out. If I don't get to experience it for the real world, how can I form an opinion?
Yeah,
You know?
yeah. So I've been saying we're kind of at a golden time in feline medicine, aren't we? Right?
Yes. It's
Right.
wonderful.
We can treat FIP. Oh my gosh. I can leave medicine now. Like, it's not that I had anything to do with it, but I feel like this is good.
And it blows my mind because I was consulting with a young veterinarian on Vin in British Columbia, and she had her first FIP case. And I
Yeah.
said to her, I said, I can't help saying this to you, but do you realize like how different this is for you as an experience? For me, it's always been
Horrible.
Yeah, we're
Yeah.
euthanizing the cat, but you actually don't even have to think about that anymore. Like, it's not even on the
All
table.
you need to know is the dose.
Yeah. So
It's groundbreaking. It's groundbreaking, right? And the medication. So one of my worries is that, because we knew some of these drugs would work
Yes.
for a while now,
Yes.
right? So the difficulty was getting them in our hands, and
Yes.
then kind of once it started, you know, boom, away it went.
Yes.
Away it went. So that's just amazing. And so what else? We've got 2 drugs for diabetes now, oral drugs.
oral drugs.
Amazing.
Yeah.
Oh my gosh.
Yeah.
Right.
There's just so much more focus on with pharmaceutical companies
Yes.
making things that are cat licensed, that are winning these iCat Care ISFM awards for giving medication to cats, which is just fantastic.
They're doing the cat first research, you know?
Yeah.
And that's just amazing.
Yeah, that's true. Cats often were considered not as good a market, right, as dogs. So, you know, for companies to put their money into cat products, I think that's making some big changes, right,
Yeah.
in recent years.
Yeah.
The cat owner population is growing faster than the dog owner population, and at least in North America.
Yeah, absolutely, and you just can't ignore that, right? Right, like whether you're a vet in private practice or. So there was a time, there's probably about. So I always date things like post-pandemic, pre-pandemic, right? So it's like a little divide in the middle of your life. Yeah, a little black hole in there. So it's probably about 8 years ago that for one company, I visited a bunch of veterinary clinics and just observed how sort of cat-friendly they were. So I just was a fly on the wall, right?
Yeah.
So I'd go in and I'd just like sit in the reception room, the waiting area, and just watch like what was happening. And, you know, the same, I'd like go in the back and just kind of like hang out and see what was happening. And when you walk into a practice like that, you know, I'm trying to see it through the owner's eyes, and it's amazing how little attention is given even in the reception area, right, to cats.
Yeah.
And the people who own practices would say, yeah, we love cats, you know, we're really happy to see cats. Not, have you ever walked in your waiting room? Because
It doesn't look that way necessarily.
Yeah, right?
And
So
it's such a little thing.
yeah, so there's a lot of almost unnoticed things, right, that we can change.
Yes,
Yeah,
absolutely.
that we can change. So,
Yes.
well, it's hard to believe that we're coming up to time. So
And you're keeping track well, so
I'm trying.
There's that.
I'm trying. There is that. Yeah. But before we go, can you talk a little bit about this team that you've put together? Just tell us a little bit more. So you said one of the big projects is you're trying to come to sort of a consensus.
Yes, just how to feed a cat. And, you know, there's so many things I think we all either know but don't realize we know. But simple things, maybe like how do we deal with our hospitalized patients?
Right.
I've heard the debate whether to buffet or not to buffet with the food. How do you offer these things? We don't want to offer our diets, you know, our long-term diets in a stressful situation. Simple things like that. And then how to help the cat parents do it at home, because it's a feeding experience. It's not just putting the food down.
Right.
And there's no one cat that's going to do the same thing. We all know.
Yeah.
So it's just, but trying to make some of these, maybe group these generalizations of types of cats and how they eat, and some of the really important nutritional things to look for with certain age groups or disease states.
Right. Yeah. So think of sort of lifestyle
Yes. Yeah.
type of things. So I don't think there's really any everything put together like that, is there?
Not all in one space.
Not all in one
so-
space. There's lots of things kind of scattered about,
Right.
and my goal is to utilize what's already been done and
Right.
kind of make something really big and robust that we can use, and
Right.
have a veterinary friendly version, and then have a maybe a client friendly version that you can give to your cat
Yeah.
owners, and just to help them at home, or hey, this is why we did this.
It's understanding how the cat
know.
should be fed, or
Do you know, now that I think of it, it's amazing nobody did that before.
Huh?
Because it is all in pieces everywhere.
Yeah, and I think it'll help a lot, especially with older cats and diet transitions.
Oh,
a
Lord,
week
yes.
isn't enough time for some of these cats. And they don't like the food. The food tastes terrible.
Yeah.
Did you actually go through a full transition? So kind of maybe some guidelines for different transitioning of diets.
Little
You know.
I'm fond of saying that a food change is not an emergency,
Yes.
right?
But
It's going to take some time.
You have to make sure the cat owner knows that
Yeah,
too.
has patience.
Yes.
Yeah.
Has some
So,
patience. Yeah.
Yeah.
I think that'll be a great resource. Yeah.
I hope so.
Yeah. And the last thing I want to make sure, so you have co-edited the feline patient textbook?
Yes. The
Okay.
last edition was assistant editor, and this edition coming up will be co-editor.
So is the new one, what number edition is the new one?
The 6th.
6. Okay.
Yes.
So I give you my sympathy as a fellow textbook editor.
I read your preface for yours, and I was like, oh, I feel that.
My gosh, Kelly's been a section contributor, editor with me as well. So I give you my sympathy on that. Yeah,
It's a labor of love.
It is, isn't it?
Yes.
Yeah, there's not enough money to pay us for this.
No, and I want to shout out to my co-editor. She has been really amazing and done so much work on this, Dr. Lisa Keel, Durso Keel. She is fabulous, and I just want to make sure she gets credit because she is just awesome. So,
And one of the things that always makes me feel good is that when you contact people and say, hey, would you write a chapter? And they do. Like, I very rarely get turned down, right? And I think, oh, we have such a generous community.
yes. I mean, I wouldn't turn down Dr. Susan Little asking, So it's.
But you're asking people to do what a chapter is a bigger project than you think, right?
Yes.
And you're asking people to do it in the midst of their busy lives.
Yeah, with really just, hey, you can have a textbook. It's not really for any kind of
Yes.
gain on their end. It's really just
That's a good
providing
point.
education.
I bet you most people don't know, right? If you contribute a chapter to a textbook, what you get is the textbook. So
Yes.
you can't even get maintenance and certification points for ADVP with a textbook chapter,
I
can you?
know, nope,
So,
or editing
not
either.
that. It's a labor of love.
No, and the amount of CE that the textbook, I feel like I've learned so much by
See?
editing. It's been just really, I love that part of it. So
that's why I did the first textbook, is the opportunity to learn. It really is. So when does it come out?
next year.
Next year.
Yeah,
So
it'll-
what you're still in the editing stage, are you?
Yes,
Yeah.
we are collecting our last submissions hopefully by November.
Right.
And then our stuff is all due in December, so we're
Okay.
hoping early 2025.
Yay!
Good.
So we'll look out for the Feline Patient 6th edition in 2025. Well, unfortunately, we really are out of time. Yes. So
Yeah.
really enjoyed talking with you, Lisa, and we expect good things to come.
Thank you
Right?
so much for having me. It's been wonderful.
Well, hopefully we'll catch up with you and do another episode, and you can talk about what's happened since then and
Yeah.
give everybody an update. So,
Yeah.
sounds great.
yeah, that's great.
With
So,
the new projects.
Thank
and your
you.
new job.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.